So the arteries and the veins, they're going to be in a closed loop, right? You picture it like a racetrack, but you also want to picture it like a tube that the blood is going to come from the heart through this tube, and then it's got to just keep coming back in this tube until it reaches the heart again. There are these little places where this kind of magic happens that we can open up and create a little space there, and we can puff oxygen into the body. We can suck any waste up into the blood, bring it back, and then flush it out of the body. Okay, so we could do any of those jobs, but they happen in the capillaries. That's going to be the place where this exchange happens because our body is closed off from our blood vessels. Our blood vessels are closed off from our body. The capillaries are the special places where they can open up and send things in and out. So when we're thinking about the size of these, we're going to come to this picture. I want us to just don't look at anything else yet. Just look at the very top of the picture. And it doesn't matter if you know what it means. We're going to build it all together. Start with the aorta. This is flowing, look at the direction of that arrow, away from the heart. So this is an artery, okay? So arteries move away from the heart. What I want you to look at now, the only thing is how thick that is. It's wide, right? It's wide. Now, just think about what we already know about capillaries. Have you ever or known anybody that burst a capillary like in their nose and you can see those teeny tiny spider veins, or in their eye? They are so small, they are so delicate, there's so many of them. How do we take something as wide as this and connect it into something as tiny as that? What we have to do is take the artery from one and branch it out into a lot of smaller ones so that we can transition to something that's going to be more narrow. Okay, so that's why when you come up this artery, it becomes like these tree branches. It's not labeled in your book, and it should be. So I took it upon myself and we labeled it here. The arterioles are the small arteries. Okay, so when you look at that, we're still in the arteries, right? We're still moving away from the heart, but we have gone from one big artery to a bunch of little ones. And the reason that we have done that we have fanned them out, is because we need those to be the right space, the right size to fit in at the capillaries. The capillaries are where we're going to open up, send that oxygen into the body. Okay, and then coming down, let's just take a pause. Look here at the top right where we see the superior vena cava. That word vena means vein. So this is like the superior, right? The high vein. You see how that too is wide, just like the aorta was wide. So we need to go from these really tiny capillaries, and now we need to go the reverse way and make small veins that are going to, just like a river. So like think of how this works, like where you have all of these little different streams and tributaries and they all come together into a river. That's what it's like in this direction. It's just the reverse of that the other way. The other way is more like a tree. This way is like coming into one river. So we have the small veins, small, getting bigger and bigger until they all funnel into one. And what do we already know that a vein is? A vessel that flows toward the heart. So now you're going to see that arrow is pointing down. Okay, so let's just think about this again. Arteries away from the heart, capillaries, diffusion, veins toward the heart. All we added was one small step, making the arteries the right size, making the veins the right size. Now, when you see that ending of the word OLE at the end of arteriole or ULE at the end of venial, this is like from the Latin for small. So arterioles just means small arteries. Venules means small veins. All right. So those words are close enough that we don't really need to learn too much to be able to see them. But it's still an artery because we're coming away from the heart. And the small veins are still veins because they're coming back towards the heart. Okay. So that was the last thing that we had written here on this slide, just looking at it with words compared to the picture. All right. So the order is going to be arteries into the arterioles, exchange, diffuse at the capillaries. Now we're going to start circling back to the heart, small veins, venules into the big veins, and then we are, boom, back in the heart. Okay. So let's think about the things that we know so far.
Like and subscribe to receive all of our NASM personal trainer certification review content. If you'd like to learn more about our full NASM CPT prep program with over a 95% pass rate and money back guarantee, head over to thecptacademy.com.